I thought it was just age. But when I started bleeding for 12 days straight, my daughter begged me to see a doctor. Turned out, it wasn't just menopause. For many women over 60, it's easy to believe that menstrual health is behind us. After all, no more cycles means no more worries, right? But gynecologists are raising an alarm. Certain symptoms, even years after menopause, can signal something much more serious. Whether it's unexpected bleeding, painful cramps, or mood swings that seem to come out of nowhere, these aren't just normal parts of aging. In fact, they could be signs of hormonal disorders, underlying health conditions, or even early warnings of cancer. Today we're diving into 6 menstrual-related problems that women should never ignore even later in life. If you've ever thought, it's probably nothing, or shrugged off a strange symptom, this video might just change your mind or even save a life. Because when it comes to your health, silence isn't strength, it's risk. And the sooner we listen to our bodies, the better chance we have to protect them. Have you ever noticed your asthma getting worse right before your period? Or felt unusually stiff and achy, even though the weather hasn't changed? Maybe you felt your blood sugar creeping higher for no clear reason. This isn't just aging. It's something doctors now call premenstrual magnification, a lesser-known phenomenon where chronic conditions like asthma, arthritis, diabetes, depression, or anxiety intensify during specific phases of your hormonal cycle. And yes, this can continue even after your period stops. For some women, hormone fluctuations don't vanish after menopause. Instead, the body still reacts to subtle changes, especially in the week leading up to when their cycle used to occur. The result: flare-ups that feel random but actually follow a silent rhythm. One woman described it like this: I'd get migraines every 3rd week of the month like clockwork. It wasn't until I tracked it with my doctor that we realized it lined up with my old cycle. The good news is, you don't have to suffer in silence. With a simple tracking chart and a supportive doctor, many women can adjust their medications or habits to reduce symptoms before they spike. Sometimes all it takes is changing when you take your medication or increasing the dose temporarily during that vulnerable window. So if you notice patterns in your pain, mood, or breathing, don't dismiss them. Hormones may still be whispering to your body long after you've stopped listening. Some women say it feels like a storm they can't escape: uncontrollable mood swings, overwhelming cravings, deep sadness, or even explosive anger that comes out of nowhere. This isn't just a bad mood or ordinary PMS. For many women, especially in their 40s, 50s, or early 60s, these intense emotional changes could be a sign of premenstrual dysphoric disorder, or PMDD, a much more severe version of PMS that's often misunderstood or dismissed. PMDD affects mood in powerful ways. You might feel fine one day, then anxious, hopeless, or tearful the next, with no clear trigger. You may lose interest in things you used to enjoy, lash out at loved ones, or feel like you've lost control of yourself entirely. Some women even describe it as not recognizing who I am anymore. What's worse, these emotional shifts often return every month just before your cycle, or in alignment with hormonal shifts that linger even after menopause. The silver lining: PMDD is treatable. In fact, low-dose antidepressants, taken only during the 2 weeks before your expected symptoms, have helped countless women feel like themselves again. You don't need to be on long-term medication, you just need the right approach at the right time. If you've noticed a pattern to your moods even late in life, it's not just stress or just aging. It may be your hormones, and there's help for that. Because no woman should feel like a stranger in her own mind. And the sooner we name it, the sooner we can tame it. Imagine this: you're well into your 50s or 60s, and you suddenly start getting intense abdominal cramps. Not mild discomfort, but pain that makes you double over. Stop what you're doing or reach for painkillers. You might think, that's strange. I haven't had my period in years. And that's exactly why you should pay attention. Severe sudden cramps in women who are near or past menopause could point to a condition called endometriosis, even if you've never had it before. While it's most often diagnosed in younger women, endometriosis doesn't always retire when your period does. In fact, in some cases, endometrial tissue, the tissue that normally lines your uterus, can grow outside the uterus, attaching to organs like the bladder or intestines. These rogue tissues react to hormones and can cause pain, swelling, and inflammation long after your cycle has ended. One woman shared that she thought she was having stomach problems only to discover the cramps were gynecological. After a few tests, doctors found endometrial tissue behind her uterus pressing on nearby nerves. The takeaway: don't ignore pelvic or lower abdominal pain, especially if it's new, intense, or recurring. It's easy to brush off as gas constipation or aging joints, but your body might be signaling something deeper. With the right care, treatments are available ranging from medication to minor surgery. But first, you have to speak up. Your body remembers everything it's been through, and sometimes it speaks up in pain when it needs your attention the most. Most of us wouldn't complain about skipping a period or two, especially in our 40s or early 50s. But if it happens more than once and you know you're not pregnant, it's time to pause and look deeper. Absent menstruation, also known as amenorrhea, may seem harmless, but it can point to several hidden health issues. For women approaching menopause, missed cycles could signal hormonal imbalances, thyroid dysfunction, polycystic ovary syndrome, PCOS, or even premature menopause when the body stops menstruating before age 40 or 45. But the concern doesn't stop there. When your body stops producing the right levels of estrogen and progesterone, the lining of your uterus can become unstable. This increases the risk of abnormal cell growth, which if left unchecked can become precancerous. Doctors often recommend a simple blood panel to check your hormone levels, thyroid function, and potential ovarian issues. These tests are quick, non-invasive, and can provide life-saving insights, especially if your missed periods come with other signs like fatigue, hot flashes, or unexpected weight changes. One woman shared that she went nearly 3 months without a period at age 44. She thought it was just early menopause. But her doctor discovered a thyroid issue that, once treated, brought her health and her cycle back into balance. The lesson: don't wait for things to go back to normal. Listen to your body. Missed cycles are more than an inconvenience. They're a message. And when caught early, that message can change your story for the better. You've gone through menopause. No more monthly cycles, no more pads or tampons. Then one day, you notice spotting or even bleeding. It's easy to tell yourself it's probably nothing, but doctors say any bleeding after menopause is a red flag. In some cases, light bleeding can happen due to hormone replacement therapy or vaginal dryness. But other times, it's your body's way of sounding the alarm. It could be a sign of ovarian cysts, uterine fibroids, polyps, or even precancerous cells in the uterus lining. One woman in her late 60s noticed light pink spotting after a walk. She waited a few days, then called her doctor. A biopsy revealed early-stage endometrial cancer. Caught in time, her treatment was short and successful. The scary part: she almost didn't call. Many women feel embarrassed or think they'll be overreacting. But the truth is, your body shouldn't be bleeding once menopause is complete. Even mild spotting deserves medical attention. Likewise, if you're still having periods and notice bleeding between cycles, it's worth getting checked, especially if you're not on birth control, which can sometimes cause this side effect. Mid-cycle bleeding can signal hormonal imbalance, polyps, or again, abnormal tissue growth. The message is clear: blood after menopause or between expected cycles is never something to ignore. It doesn't mean something is wrong, but it does mean something needs to be checked. Your vigilance could save your life or someone else's. If you're changing your pad or insole every hour, that's not normal. Not when you're 25, and certainly not when you're 55 or older. Excessive bleeding or periods that last more than 10 days can be exhausting and frightening. But beyond the physical toll, they may be warning signs of something more serious like uterine fibroids, polyps, or a condition called adenomyosis, where the tissue lining your uterus starts growing into its muscular walls. These conditions are more common than you might think, and often go undiagnosed in older women, especially those nearing or just past menopause. Many dismiss the symptoms as just part of the transition, but heavy bleeding can cause anemia, fatigue, and long-term health issues if not treated. In one case, a woman ignored her prolonged periods for months, thinking it would pass. When she finally visited her gynecologist, she was found to have multiple fibroids, some of which had grown large enough to press on other organs. Surgery wasn't easy, but it gave her life back. The bottom line: if your bleeding is so heavy it disrupts your day, or if your cycle is stretching well beyond a week, it's time to speak up. It doesn't make you dramatic. It makes you wise. No one should have to suffer in silence, especially not for something that can be treated, managed, and sometimes fully resolved. So please listen to your body, trust your instincts, and don't wait. Have you or someone you love experienced any of these warning signs? Share your story in the comments. Your voice might help another woman take action.